Hi everyone, so today we're going to be talking about cardiology and pulmonology. We're going to start off with an intro to cardiology and pulmonology, then we're going to talk about different types of cardiac and pulmonary diseases, and then we're going to talk about some risk factors, and we're going to end off with questions and a conclusion for the presentation.
So what is cardiology? Well, cardiology is the branch of medicine which deals with the heart and some parts of the circulatory system. It's the study and treatment of disorders of the heart and blood vessels. The physician who specializes in cardiology is called a cardiologist.
So, what is pulmonology? Pulmonology is quite simply a branch of medicine that studies the lungs and lung disorders relating to the lungs. The, the, the lungs are an incredibly complex organ that works with the heart to supply oxygen and take away carbon dioxide to every cell in the body, allowing you to live. Since the lungs can be very fragile and diseases in the lungs can be very complex, pulmonologists specifically study and treat these disorders.
The first condition that we're going to talk about is asthma. Asthma is a condition that affects your airways and lungs. Your airways narrow and swell, making it difficult to breathe, and this can lead to wheezing or coughing. Symptoms of asthma include shortness of breath or breathlessness, chest tightness, or trouble sleeping due to any of the mentioned symptoms. Keep in mind that these aren't the only symptoms. Asthma can vary from person to person. It can be a small deal for one person, but a life-threatening issue for another. There's no cure for asthma, but there are ways to control its symptoms. Asthma can change over time, so it's important to constantly work with your doctor. A few risk factors for asthma are having a blood-related relative with asthma, being a smoker, or having lots of exposure to secondhand smoking. There aren't exactly ways we can prevent asthma, but there are ways we can prevent asthma attacks. Some ways to prevent asthma attacks include avoiding asthma triggers, monitoring your breathing, and taking medication if prescribed. Lastly, I'm going to go over a few statistics. So in America, around 25,131,132 people have asthma. To be more specific, around 5 million of these are children younger than 18, and around 20 million are adults 18 and older. Now we're going to move on to cardiac arrest.
What is cardiac arrest? It is the failure of the heart to pump effectively, resulting in the sudden loss of blood flow. And it's good to note that a heart attack is not the same as cardiac arrest. People often use these terms interchangeably, but they are not the same. A heart attack is when blood flow to the heart is blocked, and sudden cardiac arrest is when the heart malfunctions and stops beating unexpectedly. So the main symptom of cardiac arrest is loss of consciousness or unresponsiveness, but other symptoms include pain in the chest, lightheadedness, and short of breath. Some popular treatments include medication, surgery, exercise, or dietary changes. Medication can lower high blood pressure and cholesterol. Surgery can repair damaged blood vessels or heart valves. It could also bypass or remove blockages in the arteries. Um, Exercise may improve cardiovascular fitness, and dietary changes can help you lower cholesterol. And I'll pass on to Sarah.
Hello everyone, let's talk about cystic fibrosis. So what exactly is cystic fibrosis? Cystic fibrosis is a genetic disease that causes persistent lung infection and limits the ability to breathe over time. So cystic fibrosis is mainly caused by genetics, and because of this, there's no way to prevent the disease. It is caused by mutations in the CTFR, or otherwise known as cystic fibrosis membrane conductance regulator. And when this mutation happens, the protein is unable to move chloride to the cell surface. And without the chloride to attract the water to the cell surface, the mucus in various organs become thick and sticky. This causes the mucus in the lungs to clog airways and trap germs and other bacteria, which leads to infections, inflammations, and respiratory failure, and more. There's no cure for cystic fibrosis, and there's only treatments to help soothe the symptoms. So first, there's chest physical therapy. This helps loosen and clear lung secretions. Treatment may include postural drainage. It also includes devices that vibrate the chest wall and loosen secretions. So on your picture to the right, you can see a boy with a chest vest on. The vibrations will help loosen the secretions and help the mucus go away. And the next treatment option is exercise. This helps loosen mucus, stimulate coughing, and improve overall physical condition. And third, there's medicine such as bronchodilators, I can't say it properly, sorry, and anti-inflammatories. This is used to decrease inflammation and swelling and thin the mucus. And lastly, there's antibiotics that help treat the infections. That's it for cystic fibrosis. Next up is heart infection.
Hello everyone, we'll be moving on to heart infection. So heart infection occurs when an irritant like bacteria, fungi, or virus reaches your heart muscle, causing an infection which can lead to inflammation or damage to your heart's valves, inner lining, outer membrane, or even just the heart itself. There are three main types of heart infection: endocarditis, pericarditis, and myocarditis. Endocarditis is the inflammation of your heart's inner lining called the endocardium, and it can occur when germs travel through your bloodstream into your heart. Pericarditis is the inflammation of the sac-like structure that covers the outer part of the heart called the pericardium, and this one can be caused by a viral infection or after a heart attack or a heart surgery. And myocarditis is inflammation of the heart muscle or the myocardium caused by an autoimmune disease or a viral infection. Symptoms depend on the type, but some common symptoms include shortness of breath, fever, fatigue, aching joints, and chest pain. Treatment also depends on the type. For an infection caused by bacteria, antibiotics might be used, and if it worsens or it's a different type, surgery might be used. So to prevent heart infection, we can have good oral hygiene, and this just helps because it lowers the risk of bacteria building up in your mouth and into your bloodstream, and just having good hygiene in general. Also avoiding any procedures that might allow germs into your bloodstream. And that's all for heart infection. We'll be moving on to bronchitis.
Bronchitis is the inflammation of the lining of your bronchial tubes, which carries air to and from your lungs. There are two types of bronchitis, acute and chronic. Acute is a short-term illness which clears in a few weeks and usually occurs after a cold or viral infection, such as influenza. Meanwhile, chronic bronchitis is a long-term illness and can result from environmental factors or extended illness. These external factors include cigarette smoking, air pollution, exposure to pesticides, dust, and toxic gases. Chronic bronchitis is most likely to affect older adults, infants, and young children, as colds or viruses can easily compromise their immune system and make them more vulnerable to infection. Symptoms for both acute and chronic bronchitis includes coughing, mucus production, shortness of breath, and fatigue. To prevent bronchitis, it's important to avoid cigarette smoking or even secondhand smoking. Additionally, it's important to get your yearly flu vaccine since many cases of acute bronchitis results from influenza, which is a virus. Another important way to reduce your chance of catching a viral infection is to wash your hands frequently. Some treatment options for acute bronchitis include cough medicine, but in most cases, since bronchitis is a viral infection, antibiotics aren't that effective. Since there's no cure for chronic bronchitis either, lifestyle changes play an important role. This includes eating a healthy diet, moderate exercise, and to avoid smoking. Additionally, medicines known as bronchodilators or bronchodilators and steroids open up the airways and help regulate breathing. Lastly, there's pulmonary rehabilitation, which is a breathing exercise program in which a respiratory therapist teaches you how to breathe more easily and increase your ability to exercise. Now on to congenital heart defects.
Now we'll be talking about congenital heart defects. Congenital heart defects are abnormalities in the heart that develop before birth and affect the structure of the heart as well as the way the heart works, since they change how the blood flows throughout the heart and body. The causes of congenital heart defects aren't widely known, but doctors do know that there is a disruption of heart development within 6 weeks of the pregnancy. Some other things that are said to cause or increase risk for congenital heart defects include genetic conditions, maternal diabetes, alcohol, rubella, the flu, and medications. Genetic conditions such as Down syndrome, Turner syndrome, and Noonan syndrome increase the risk as they can all cause a range of symptoms of congenital heart defects. Maternal diabetes can cause high levels of insulin in the blood, which can interfere with the fetus's heart development. Alcohol can cause congenital heart defects as it can have a poisonous effect on the fetus's tissue. Rubella can cause multiple birth defects, including congenital heart defects if the mother catches it within 8 to 10 weeks of her pregnancy, and if the mother gets the flu within 3 months of her pregnancy, there is also a high risk for congenital heart defects. Medications, including certain anti-seizure and acne medications, as well as ibuprofen, can increase the risk for congenital heart defects if taken while pregnant. Some symptoms of congenital heart defects include abnormal heart rhythms, blue-tinted skin, nails or lips, difficulty breathing, sleepiness, not being able to feed or develop properly, and if the baby has swollen tissues or organs. Common treatments for congenital heart defects include medications, surgery, and catheter devices. Surgeries are only used if the congenital heart defect is critical or life-threatening. Medications can be used to help lower blood pressure and help regulate heart rate. A catheter is a tube which is threaded through blood vessels and into the heart, and it helps doctors treat congenital heart defects. There are many types of congenital heart defects, but the most common ones are ventricular septal defect, atrial septal defect, pulmonary valve stenosis, and aortic valve stenosis. Ventricular septal defect is when there are holes in the bottom chambers of the heart, which can cause heart failure. Atrial septal defect is when there's an abnormal hole between the upper two chambers of the heart. Pulmonary valve stenosis is when blood can't properly flow from the right ventricle into the lung, and aortic valve stenosis is when the aortic valve may be too small, which can make it hard for the blood to leave the heart. Some prevention steps for the mother to take to make sure the baby does not have congenital heart defects include being vaccinated so the mother doesn't get the flu or rubella, avoiding alcohol and close contact with organic solvents, and asking their doctors before taking any medications to make sure it won't affect the baby. That was all for congenital heart defects. I hope you learned something new.
Right, so moving on, let's go over chronic obstructive pulmonary disease, also known as COPD in abbreviation. Most of you might have never heard of this term, so to briefly explain it, chronic obstructive pulmonary disease is where there is an inflammatory in the lungs that causes obstructed airflow from the lungs. Some of these causes include tobacco smoking. In developed countries, the most cause of this is tobacco smoking. Another cause is being exposed to fuels such as cooking or heating in poorly ventilated rooms. Unfortunately, people with asthma are also at a higher risk of developing this disease. Frequent exposure to dust and chemicals can lead to developing this disease too, because these dust and chemical may be harmful as it builds up or stacks up over time. So it leads to irritating and inflaming your lungs. The last factor is genetics. Sometimes if you have a family history or member who develop chronic obstructive pulmonary disease, you may be more susceptible, unfortunately. Here are some of the following symptoms you should look out for just in case it may be chronic obstructive pulmonary disease. Constant shortness of breath after physical activity such as running or especially after small workouts may be a sign. Chest tightness or pain, chronic cough that produces mucus, which may come in the color white, yellow, clear, or green, frequent respiratory infections, unintended weight loss, and swelling in the ankles, feet, and leg, all may be a sign. If any of the above I mentioned becomes extremely serious, please check with a doctor as soon as possible. There are ways of treating chronic obstructive pulmonary disease. One way is to quit any type of smoking as it is one of the biggest causes. Taking medications such as inhaled steroids, combination inhalers, or oral steroids. Please note that for any of these medications, please do not overdose it and make sure to take the recommended dose unless otherwise instructed by your doctor. Lung therapy such as oxygen therapy can also help as well. Lastly, if it gets extremely serious, there will be surgery, as in getting, for example, lung transplant. There are many ways you can lower your chances of developing this disease. First one is to basically avoid any type of smoking, which can significantly lower your rate. Another way of prevention is to get your annual vaccinations, such as the flu shot, because this can help strengthen your immune system to become stronger against fighting diseases. Lastly, regularly checking up with your doctor is very important, as they could check if you have any, like making sure you're healthy or just making sure you're safe. Also, that's about it for this presentation. All right, I hope you guys learned something new about chronic obstructive pulmonary disease. I'll be passing on to Connie.
Hello everyone, so let's talk about congestive heart failure. Congestive heart failure, usually known as heart failure, however there's more to this term than you think. The process of this condition is what adds the word congestive to this term. In congestive heart failure, such conditions weaken your heart and blood is pumped slower. As a result, the ventricles that pump blood throughout your body start to pump less blood and fluids start to build up in your organs. The buildup of fluids is what congests you. But what causes this condition? Heart attacks, coronary artery disease, diabetes, cardiomyopathy, high blood pressure, and sometimes a stiff heart that can't pump or accept blood well can lead to congestive heart failure. Any condition that weakens your heart or harms your blood flow could lead to congestive heart failure. And you can look out for these symptoms of congestive heart failure if you have any of these conditions. Look out for weakness, irregular heartbeat, water retention, which means water is stored and it creates such congested organs, congested lungs, chest pain, coughing, and shortness of breath. As soon as you see or feel these symptoms, go to a doctor ASAP. They may diagnose you through EKGs, blood tests, stress tests, echocardiograms, cardiac catheterization, which is a tube that is threaded into your blood vessels to your heart, and MRIs. The diagnosis may be systolic dysfunction, where your left ventricle cannot contract and pump blood throughout your body properly, or diastolic dysfunction, where your left ventricle becomes stiff and cannot fill the heart with blood. Once they have determined that you have congestive heart failure, they may prescribe you various medicines to treat you. ACE inhibitors help open up blood vessels for blood flow and decrease the workload of your heart. Beta blockers help reduce blood pressure and slow down your heartbeat. Diuretics can help you urinate and reduce the amount of fluids in your body, helping the congestion in your body. If medicine doesn't work, you may have to resort to surgery, where surgeons might open up blocked arteries or repair your heart valves. There's also a device named LVAD that helps your heart pump blood, and the most severe treatment would be a heart transplant. Luckily, there are many ways to prevent congestive heart failure by preventing the causes. For instance, being active, eating healthy, and not smoking prevents congestive heart failure. Hopefully, we can continue healthy habits for a healthier heart. Now, let's move on to pulmonary embolism.
All right, now let's talk about pulmonary embolism. So first off, what is it? Pulmonary embolism is a blockage to one of the pulmonary arteries in your lungs. It occurs when a clump of material, most often a blood clot, gets wedged into an artery in your lungs. These blood clots most commonly come from the deep veins of your legs, a condition known as deep vein thrombosis. In many cases, multiple clots are involved in pulmonary embolism. The portions of lungs served by each blocked artery are robbed of blood and may die. This is known as pulmonary infarction. This makes it more difficult for your lungs to provide oxygen to the rest of your body. Occasionally, blockages in the blood vessels are caused by substances other than blood clots, such as fat from the marrow of a broken long bone, part of a tumor, or air bubbles. Pulmonary embolism symptoms can vary greatly depending on how much of your lung is involved, the size of the clots, and whether you have underlying lung or heart disease. Some conditions and symptoms include rapid or irregular heartbeat, lightheadedness or dizziness, excessive sweating, fever, leg pain or swelling, shortness of breath, a cough, and chest pain. Preventing clots in the deep veins in your legs will help prevent pulmonary embolism. For this reason, most hospitals are aggressive about taking measures to prevent blood clots, including blood thinners, compression stockings, leg elevation, physical activity, and pneumatic compression. In addition to taking these precautions for prevention of obtaining pulmonary embolism, you can also pay attention and avoid these risk factors that contribute to obtaining the clots. The risk factors include smoking, being overweight, supplemental estrogen, which could include things like birth control and hormone replacement therapy, and pregnancy. Now that we've learned about pulmonary embolism and how to avoid it, let's move on to aortic aneurysms.
The aorta is the largest artery in the body that carries blood from the heart's left ventricle to other parts of the body. And since an aneurysm is an enlargement of an artery, an aortic aneurysm is an abnormal bulge in the aorta. There are many different causes of aortic aneurysms, but the two main reasons are atherosclerosis and hypertension. Atherosclerosis is when fats and cholesterol plaque build up in the arteries, which cause it to harden and block blood flow in that area. Hypertension is another word for high blood pressure and can cause the aortic walls to expand, which forms a bulge and prevents blood flow as well. Other causes include genetic mutations inherited by parents, which result in abnormalities in the aorta, and infections where bacteria piles up and travels to the aorta, forming an aneurysm there. Since the aorta is located near the lower spine, the symptom of this disease includes lower back pain. Other symptoms also include chest pain, low blood pressure, and some trouble with breathing. If the aneurysm is less severe, a doctor may prescribe medication like beta blockers to lower blood pressure and relax the blood vessels. However, if the aneurysm continues to grow, a surgery called open abdominal repair might be the only option, where the doctor would open up the abdomen, remove the bulge, and replace it with a graft, which is a fabric tube. A less extensive surgery called endovascular repair may instead be performed to remove the aneurysm, where the doctor places a stent graft in the aorta to reduce the pressure on the weakened aortic walls. There are many ways to prevent aortic aneurysms, some of which are exercising to lower harmful fats that can build up in the arteries, maintaining a healthy diet to avoid atherosclerosis, not smoking to not let the aorta expand and possibly rupture, and maintaining low levels of stress to avoid hypertension. Overall, aortic aneurysms can be life-threatening depending on the severity, but regularly taking care of yourself can help you stay healthy and avoid this disease. Now on to learning about the coronary artery disease.
Coronary artery disease, or CAD, is a disease that develops over time and involves a reduction of blood flow to the heart muscle. This is due to the buildup of plaque that causes them to narrow over time. This process is called atherosclerosis. Woo. To the image to the right, you can see one normal artery and one artery that has been clogged up with plaques. And one has a bigger area where the blood can flow. So, yeah. Okay. So looking at the symptoms, they include angina or chest pain, discomfort, and shortness of breath. Also, for some people, the first sign of CAD is a heart attack, which makes sense because this is when the heart muscle isn't getting enough blood, which would make plaque buildup that slows the blood flow to lead to a heart attack. So, yeah. Overweight, physical inactivity, unhealthy eating, and smoking tobacco are risk factors for CAD. Also, having a family history of heart disease, especially ones of having heart disease at an early age, 50 or younger. Okay, and next we can go to tuberculosis.
All right, so now we're going to move on to tuberculosis. Tuberculosis is an infection in your lungs caused by the bacterium, Mycobacterium tuberculosis, which is transmitted in the air by coughs and sneezes. It primarily affects your lungs. However, it can have lingering effects on other parts of your body, including your spine, kidneys, and brain. In most people with healthy immune systems, the bacteria is killed easily, so the tuberculosis won't affect them. This is called latent TB. However, in those who are immunocompromised, such as those with HIV, cancer, diabetes, and other medical conditions, TB can cause symptoms to present and it can become deadly. This is called active TB. Symptoms of tuberculosis in those with active TB include a lingering cough, blood while coughing, chest pain, such as when you breathe or cough, significant weight loss, fatigue, fever, night chills, and more. The treatment of tuberculosis includes several medications, which can incorporate drugs and antibiotics. However, in the rare occasion, these medications can cause significant side effects. When taking medications to treat tuberculosis, it is imperative that you take the correct prescription in the duration of time your doctor recommends. There have been certain cases where patients only take these medications in a short period of time, so less than what their doctor recommends, which allow the bacteria to still survive, and then the bacteria becomes resistant to the drugs, making the bacteria drug resistant and much deadlier. So yeah, thank you for listening to my presentation. We'll now move on to pneumonia.
Hello. So, pneumonia, something that is commonly heard of, but do we know what it is? Well, pneumonia is an infection caused by bacteria or viruses, such as a simple cough or cold, or even fungi, that causes the alveoli in the lungs to inflame or blow up. Alveoli are like these little air sacs, and when they do inflame, fluid builds up in between the tissues inside the lungs. Pneumonia can be a mild infection that's easily treatable, but it can also be life-threatening at times. Some symptoms that this inflammation will cause are chest pain, coughing, fatigue, high fevers, nausea or vomiting, and just overall trouble breathing. In order to treat it, one just has to take prescribed medications such as aspirin and ibuprofen and stay at home. Having a lot of water and maintaining a good diet is important during recovery as well. Drinking fluids is one of the best ways to help fight off the disease. It's a pretty uncomfortable disease, so if you know someone that has it, treat them with a lot of care. I will now pass it on to Liz, who will talk about the overall risk factors for cardiac and pulmonary diseases.
Now we'll go over some risk factors for cardiac and pulmonary diseases. Risk factors can be found in the environment, in genes, in lifestyle, and much more. First, health conditions such as high blood pressure, high cholesterol, diabetes, and obesity are risk factors for cardiac disease. High blood pressure and high cholesterol are the more common risk factors, and they both usually have no symptoms. There are also many risk factors based on lifestyle and behavior. Having a diet when you're eating lots of trans fat, saturated fat, and cholesterol is one risk factor of cardiac disease. Another risk factor is not enough exercise. Not exercising enough can not only lead to heart disease, but actually exercising enough can help to reduce the risk of heart disease. Also, too much alcohol raises the levels of a fatty substance in the blood called triglycerides, which increases risk. The risk factor you guys are probably most aware of is tobacco use, specifically cigarette smoking, nicotine, carbon monoxide from cigarette smoke, and exposure to secondhand smoke. Smoking injures the heart and blood vessels, raises heart rate, creates timing irregularities in your heartbeat, and damages arteries, while nicotine increases blood pressure, carbon monoxide lowers the oxygen levels in your blood, and secondhand smoke, even if you aren't a smoker yourself, still makes you more prone to cardiac disease. In addition to behavioral risk factors, there are also genetic risk factors for cardiac disease. If one's family has a history of cardiac disease, younger generations are more likely to get it because those genes are passed down. Another risk factor is age. As we get older, specifically past 65, our risk for cardiac disease increases. Pulmonary disease have similar risk factors as well. The general risk factors of pulmonary diseases are tobacco, aging, family history, and obesity. Tobacco is very detrimental to the respiratory system by releasing many harmful toxins, damaging airways, and weakening lung resistance to infections, making it a major risk factor for pulmonary diseases. Just like aging affects the heart, it makes the lungs weaker. Obesity is also a general risk factor for most pulmonary diseases because it compresses parts of the respiratory system and reduces respiratory muscle strength. Certain pulmonary diseases have specific risk factors. First, as went over, risk factors of aortic aneurysms are other aneurysms and being male. For pulmonary embolisms, the risk factors are broken bones, surgery, history of cancer, being pregnant, and damage to a vein. The risk factors of COPD are the environment, having respiratory infections as a child, and the genetic condition alpha-1 deficiency. Air pollution is also a risk factor to asthma, in addition to allergies and viral respiratory infections. Lastly, the risk factors of bronchitis are gastric reflux, working close to lung irritants such as chemical fumes, and a compromised immune system. That's all for risk factors. Keep in mind that not all of these risk factors are necessarily in your control, but it is important to be aware of them to recognize if you are at risk of cardiac or pulmonary disease.